In this video, I will discuss frequently asked questions for Prometric, MOH, HAAD DHA and NHRA exams for nurses. Here is the question. Question number 1. While caring for a patient in the post-anesthesia care unit who has developed hypovolemic shock, a nurse should position the client. So currently the patient is there in post-anesthesia care unit. After surgery, the patient has developed hypovolemic shock. What is hypovolemic shock? It is one type of shock in which the blood volume lost. It is associated with surgery. Following surgery, bleeding is an expected immediate complication. So this hypovolemic shock could be because of bleeding. Okay, so patient has developed a hypovolemic shock. So what position you will provide for the patient? Okay, so there are 4 positions are given. So we will try to remove the wrong answers. Fine. So number 1, a flat with a leg elevated. When you give this position, the blood supply towards the heart will increase. So this will improve the condition. High Fowler's position, and with the hand of the bed elevated up to 45 degrees, that is semi-Fowler's position. When you give high Fowler's and when you give semi-Fowler's, the blood supply towards the lower area will increase. It will always reduces the blood supply towards the heart. So these 2 options will not help. And completely flat. It is not a suitable position. So what is the correct answer for this question? Is flat with leg elevated, or it is considered a slightly head low position. Fine. So the correct answer for this question is flat with leg elevated. Clear? So this is the answer. Fine. Next question. Next question topic. So the question is from Alzheimer's disease. So we'll just go through what is Alzheimer's disease. So Alzheimer's disease is a neurodegenerative disease that usually starts slowly and progressively worsen. Okay, it is the main cause for dementia. You have to remember all of these points. And the early sign of Alzheimer is memory loss, whereas current memory or the present memory won't be intact, and the past memory will be intact. That means the patient is able to remember which had happened in the past, but currently what is going on, the patient won't be able to recollect. Okay, present memory will be absent and the past memory will be intact in Alzheimer. Okay, and that is considered as a cause for dementia. Fine, and this is a neurodegenerative disease that usually starts very slowly and progressively worsens. Okay, so next question is from Alzheimer's disease. Okay, so an 82-year-old man with Alzheimer's disease had moved into long-term care facility 2 weeks previously. Since then, the staff has found her wandering in the hallway in the middle in the night. Okay, and when the nurse approached the patient, she is confused and frustrated, often forgetting where she is. Which intervention would most likely decrease the patient's confusions? Okay, currently the patient is there in long-term care facility, and the patient has came there 2 weeks before, and from the admission itself, the staff has found her wandering in the hallway in the middle of the night. Okay, when the nurse approached the patient, she is confused and she is continuously forgetting or often forgetting where she is. Okay, so that is a peculiar sign of Alzheimer. And which intervention would most likely decrease the patient's confusion? So the key point of this question is which intervention would most likely, you have to just remember, it is most likely decrease the patient's confusion. Fine. So we'll see the options. First is administer a sleeping sedative, and second, provide full-time nursing care and place a night light in the room and provide a large meal before bed. Okay, so we will remove the wrong answer first. We'll try to remove. See, in this particular situations, you are not supposed to give sleeping aid. Here, the patient is not having a problem with the sleeping. Okay, so you can just remove option A. You can remove this and provide full-time nursing care. That means you can continuously monitor the patient and just orient the patient. So that is an okay management. It is okay. You have to do that. Otherwise, the patient is not going to remember the entire thing what is happening currently. Okay, even if you give information or if you orient also, the patient won't be gaining the full memory even after giving orientation. Continuously you need to inform regarding the current situation. And placing a night light in the room, that won't be helpful. Okay, so we can remove that. And provided a large meal before the bed. Even that is not a suitable answer. So the correct answer for this question is second option, that is provide full-time nursing care. Okay, though you have given multiple time, you have oriented the patient, still if patient is not remembering the thing, it is quite normal associated with Alzheimer's disease. Okay. Next question again is from Alzheimer's disease. 82-year-old man who has Alzheimer's disease is admitted to the acute care unit. She frequently gets out of bed and water in the hall, unable to find her way back to her room, and she even gets in the bed of other clients. Okay, and what nursing action is most appropriate for this client? So what nursing action you would provide for this client? Again, the patient is confused with the present situation and patient is not completely oriented. Okay, and often she forgets where she is. Restrain her so she will not wander in the hall. See, option A is not the correct answer. See, restraints are used to, or it can be applied for a patient who is agitated or who is in emergency situations or who is completely irritable and which is causing, that irritability is causing her harm to the patient or to the other patient. Okay, so that is the situations where you can provide restraints, and that is only in emergency situations or in a needy situations. Fine. So A you can remove. And next is ask her roommate to call the nurse whenever she leaves the room. See, roommate here is also a patient. Okay, so this is again a wrong situation. And punish her when she gets in the bed other than her own. Again, punishment is not the better solution. And put her favorite picture on the room to her room. Okay, on the door to her room. Yeah, this will help her to identify or orient her position or her room when you keep her favorite picture. Okay, so you have to just ask her what is your favorite picture. For example, if her favorite picture is a red rose, you can keep a bunch of red roses in front of her room or on the door of the room, so that when she look at that, she will get a remembrance, or she will get an idea that, oh, this is my room, and she can get into the room. Okay, so you have to orient the client by keeping a favorite picture, or you could place a calendar so that she will be able to identify, orient regarding the time. Okay, even place can also be oriented by keeping a name of the place in a wall letter. Okay, so frequently you need to orient the client. It is very, very important because this particular disease is a degenerative neuro disorder, whereas it affects very slowly and progressively it worsens the symptoms, and current memory will be failure and past memory will be intact in this particular patient. Okay, so we'll see next question. This is the next question. What is the most accurate diagnosis to detect TB, pulmonary point of this question is most accurate. Okay, so what is the most accurate diagnosis to detect pulmonary TB? Okay, A is Mantoux test or skin test, tuberculin test. Second is X-ray, sputum culture and ABG. So what is the most accurate diagnosis to confirm the diagnosis? It is sputum culture, AFP. Okay.